First off, hello, my name is David Armstrong, and I'm the Director of the Health Workforce Tactical Assistance Center. Now, today's webinar is entitled, Taking an Anti-Racist Approach in Health Workforce Research. And following today's presentation, you will be given the opportunity to ask questions using the Q&A panel on your screen. So please, by all means, take advantage of that. Now, let me go ahead and introduce you to our guest moderators. Today, we're joined by Michael Dill, the Director of Workforce Studies at the Association of American Medical Colleges, and Xiaochu Hu, the Research Manager of Workforce Studies at the Association of American Medical Colleges, and now the Chair of AcademyHealth's Health Workforce Interest Group Advisory Committee. Xiaochu, would you like to tell us a little bit about the Advisory Committee?
Thank you, David. My name is Xiaochu Hu, a research manager at the AAMC. I am also chairing the AcademyHealth Health Workforce Interest Group. The AcademyHealth Workforce Interest Group is a focal point for networking, dialogue, and dissemination of high-quality health workforce information of interest to policymakers, practitioners, and other stakeholders. Our mission is to improve health and healthcare by promoting research and dissemination of evidence that informs health workforce policy and practice. The interest group participation is a benefit of AcademyHealth membership. Please join our IG and get on the listserv to share and get information for future events like this. In addition, the IG is led by a dedicated group of volunteers who help shape the information provided to IG members each year. The advisory committee is selected on an annual basis with nominations opening in June of each year. For more information, please contact me or our Vice Chair, Deborah Goldberg. Now, Michael, would you like to go next?
Thank you, Xiaochu. Again, my name is Michael. I'm the Director of Workforce Studies at AAMC, and we're thrilled to be collaborating with the Health Workforce Technical Assistance Center on helping to put together today's learning opportunity. Briefly, the Workforce Studies team at AAMC collects and disseminates data and conducts research on the nation's physician workforce. If you're interested in learning more about the work that we do, then please visit our website at aamc.org/workforce. However, the main reason I'm here today is to introduce our illustrious panelists. So without further ado, I would like to introduce those three individuals. I was fortunate enough to experience this learning in person in May, and I'm very much looking forward to hearing from them again today and learning even more. Our panelists are Meagan Call-Cummings, who is an Associate Professor of Research Methods at Johns Hopkins University. Meagan's work focuses on amplifying the voices of youth by facilitating youth-led research on topics important to those youth. She co-directs the Youth Research Council, which brings together 35 diverse high school students from over 20 high schools in Virginia to conduct mixed methods research on the mental health effects of racial discrimination in schools. Sharrell Hassell-Goodman is an adjunct professor of integrative studies at George Mason University. Sharrell's current research interests include first-generation college students, Black women in higher education, identity and leadership, and anti-racist decolonial research methods. Her dissertation focused on how first-generation women of the African diaspora navigate higher education. And our third panelist is Giovanni P Dazzo, who is an assistant professor of qualitative research at the University of Georgia. Giovanni is an interdisciplinary researcher and evaluator who integrates theories and methodological practices from anthropology, community psychology, restorative justice, and conflict transformation and education. Prior to joining the University of Georgia, he led the Research and Evaluation Unit at the Department of State's Bureau of Democracy, Human Rights, and Labor. And with that, welcome, and I'm going to turn it over to, again, our illustrious panelists.
Thank you, Michael, Xiaochu, David, everyone. Thank you so much for having us here today. And thank you to those of you who are here. Looks like there's a little over 40 participants. So we're super excited to be here with you. And we're also excited for those who will watch this later asynchronously. We hope that it's helpful to you all. I'll start out, and then Sharrell, Giovanni, and I will just kind of rotate through what we have planned for you today. Keep in mind, of course, that this originated as a, I think, 4-hour workshop previously, and we've done it most often as a series of 3 2-hour workshops. So this is a slice. This is just kind of a quick bite to sort of whet your appetites for delving further into not only what anti-racist research is, but how you too can take an explicitly anti-racist approach in your research and also in your consumption of research and making decisions about what types of research you'll rely on in your practice. So with that, just want to kind of establish a little bit of a baseline here, what we're talking about when we say anti-racist research. What do we mean? We answer that by first acknowledging 3 key points that are listed here that really form the basis of our understanding of anti-racist research. And when I say our, I mean myself, Sharrell, and Giovanni. First, we acknowledge that our roles as researchers are historically problematic, right? That's a baseline understanding. We can see through history, violence has been done in the name of research repeatedly and continues to be today. But historically, people and communities have experienced loss, traditions have been stolen, biological material has been taken without consent, all in the name of research. So that's the first kind of key consideration or baseline understanding that we operate within. Second, we acknowledge that researchers, research, and methods all exist within a historical context of racism, subjugation, and control. This is another key understanding that research and methods are not neutral, even though they are so often treated and taught and used as such. They are not ahistorical. So this historical context of racism must be taken into consideration when we talk about how or why we conduct anti-racist research. And then the third bullet point there that you see is that we have a moral and ethical obligation as researchers, as knowledge producers, even as practitioners who rely on research, to interrogate our research goals, methods, and strategies, and to resist, disrupt, and dismantle white supremacy in the context of academia and research. So this webinar, take a deep breath, starts there. And we want to be clear, as I said previously, this is just a beginning. We want to say here now, this webinar is not intended for you to view and then sort of consider yourself somehow magically anti-racist, right? Like a certified anti-racist researcher, because you can put this on your CV or list this on your wall, right? This is a beginning. If you continue to watch and engage with us during these next several minutes, you'll see that there's a lot of work to do. And it really never stops, right? We learn some things like we're doing today. Our understanding grows. Our practices may shift to be perhaps more in line with our new understandings, and our way of being changes over time. But we have all been socialized in racist, white supremacist ways because of just being in this world, right? And so there's a constant struggle between new understandings and old ways of being. So consider this webinar an invitation to make commitments to lifelong struggle and change. Next slide.
Thank you, Megan, for kind of laying the groundwork on that. And I want to continue thinking about what anti-racist research looks like through these additional points. So the first one that we want to cover is how it decenters whiteness as the primary or majority view. And what we mean by that is not simply decentering white people, right? We often think of that, but really it's this pervasive dominant culture that erases other cultures and other ways of being. So decentering whiteness as the standard in which others are measured, right? Or the acceptance of the marginalization of the dehumanization of others. So one example that we can think about this is even taking a critical look at how some of our previous research studies and what we found in ways that we can think about advancing that in ways that doesn't center whiteness. And an example of that was looking at how patients' race or ethnicities are used in clinical diagnosis. So Dr. Clyde Yancey's work and research that points to the pulmonary functions for Black patients that are still used today that dates back to the 19th century beliefs of eugenicists, right? That Black people have lower lung functions than white people, right? And how that is then used, those same parameters are still used today, and how that can cause serious problems that are missed. So just taking that in an example that we currently see in practices. So instead, how can we think about research that utilizes a decolonial and non-Western lens? The second piece is how can we reframe research questions from what's wrong with people to what's wrong with structures and systems. So it reframes research questions that works from this deficit perspective thinking that situates people as problems, and it focuses on fixing people rather than fixing the oppressive and disabling system. So examples of this could be researchers who study historically marginalized people or people who are, quote, at risk, and what may hinder healthcare, right? Instead of thinking about the barriers of preventative healthcare. So when we use the deficit frame to respond to an issue, it's really rooted in blaming the victim orientation without acknowledgement of the flawed systems or lack of resources that impact appropriate healthcare, right? So instead of thinking about access to care, we're thinking about people that are not using the appropriate healthcare. So when we're thinking about the deficit perspective, it's also important that we're careful about terms like resilience or grit, especially when success or failure is predicated on the individual. So really, it's more on transferring systems and inequalities rather than having an emphasis on people. The other piece, and this is the third bullet point, is acknowledges harms perpetuated through research and dismantles how they occur across methods, dissemination, right, or the way we share our findings, publication. But anti-racist really exposes the harms and recognizes the way in which research is inherently violent. In the United States and globally, we know that research has been, really wielded as a tool or a weapon to dehumanize, steal, pilgrim people of color, indigenous people, and to privilege and empower white people, that propping up these structures and systems of white supremacy that Meagan also just talked about. And we have to recognize the long US history of research and atrocities against Black, indigenous people of color, from the US Public Service study of untreated syphilis for Black men, forced sterilization. There's even a book on medical apartheid that examines the dark history of medical experimentation on Black Americans from colonial to the present. And we could go on, and we're more than willing to share resources that you can think about with this. But what is important for us is how can we consciously consider how to build trust between researchers and communities of color, right? How are we consciously considering developing relationships instead of simply extracting data from participants and exploiting the participants for their data and their information? All right, we're ready for the next slide.
And as Meagan and Sharrell mentioned in their overviews, when we think about being anti-racist, it means that we need to be intentional. When it comes to our own research, what does this mean? It means we need to call out our own thoughts and actions to question, is my research actively or passively racist? Am I following a mentality that is segregationist or assimilationist, or actively anti-racist? It also means working against a deficit narrative, or as Sharrell mentioned, starting with the idea that people are deficient or the problem. Now, this type of narrative that considers people to be the problem can lead, whether intentional or unintentional, to what is called damage-centered research. This pushes us to think about what our research wants to achieve as we move to an intentionally anti-racist stance. It also means complicating the idea of validity and teasing out how ethics and validity are intrinsically interrelated. Now, in our writing, we often talk about how the term validity, outside of how we use it from a research perspective, originates from the Latin word validus, which simply means strong or healthy. But this term came from valeo, which means I am healthy, I am strong, or I am of worth. So I often question if our research is rigorous, or what we define as empirically or scientifically valid, does it promote the validity, that is, the strength, health, and worth of the communities we're working with? So engaging in anti-racist and decolonial research means that one takes responsibility for the questions they ask and the research they produce, as well as the way that these processes could potentially dehumanize and decenter experience, especially those of the populations being studied. It also means that we need to acknowledge that we may be unintentionally centering white and/or colonial perspectives that have historically occupied the majority view in science, media, etc. For instance, how do you think about your research questions? Do your current citation practices intentionally, unintentionally, or subconsciously follow racist or colonial practices? And how do you involve community members in ways that respect their time and knowledge, as well as their land, language, and life systems? On the next slide, Meagan will cover this in more detail through our individual action plan.
Thank you, Giovanni and Sharrell. So the rest of our time with you today will be spent reviewing what Giovanni mentioned, this individual action plan. This is a tool that Giovanni created in our work together and that we have presented in several contexts, not only to public health researchers, but also to educational researchers, nursing practitioners, academics in psychology, sociology, even environmental science, and more. This tool has really proven to be really helpful and is a nice starting point to considering how we can make changes in our own practices to be more in line with an anti-racist approach in our research. So as we walk you through each portion of this plan over the next few minutes, we ask that if it's recorded and you're watching this on your own, you pause the webinar and reflect on your own commitments, clarify for yourself your own practices related to each portion of the plan, make goals for taking action to be more in line with an anti-racist agenda, and then consider how you'll hold yourself accountable. Over the next few minutes, if you're here with us live, you might consider going back to the recorded webinar to take some time to do that pausing, that thinking, that planning. But if you're recorded or not, if you're live today, grab a pencil, grab a pen, grab some paper, whatever you've got around you, because this is really meant to be an action-oriented time over the next few minutes or however long you end up using this webinar. So we'll now turn to discussing these 6 sections of the action plan. First is positionality, who we are and why that matters in the context of research, how we are implicated in all aspects of our research and what that looks like. Then we'll talk about literature, as Giovanni mentioned, who we cite and why that matters. Then we'll turn to research design and research questions. How do we frame our research in more explicitly anti-racist ways? Then we'll look at methodology. What are the methods we're using for example, data collection? Who's involved? How do we select participants or engage in anti-racist sampling procedures? And then analysis. What does anti-racist data analysis look like, right? And how can we make those changes to be more anti-racist in our data analysis, quantitative or qualitative? And then we'll end by thinking about how we share our findings in explicitly anti-racist ways. So let's get started. Next slide, please.
When we think about positionality, it's important that we think about ways that we approach an anti-racist research approach. Really, it needs to start here with our positionalities. What does anti-racist research mean to you? So we went over some tenets at the beginning, and we talked about how this is important to approach this work. But really, what does it mean to you? What are your epistemological commitments? And when I say that, how do we come to know, right? If epistemology is concerned with the nature of knowledge and the different methods of gaining knowledge, then what does it mean to engage in anti-racist research work when some of what we know and how we come to know it might really be impacted by notions of white supremacy. It might be impacted by racist ideologies and perspectives. As researchers, we really have to reconcile with that and being really intentional about our positionalities. When we think about that, how are your identities? How are your gender, your race, your ethnicity, your sexual orientation? How does it affect how you conduct research? How does it affect how you show up as a researcher, right? Using myself as an example, as a Black woman who also identifies as biracial, how I show up in certain spaces dictates how much folks maybe share about their experiences in the health field, right? Share their experiences as students, right? Share their experiences in the classroom. So really, when we're thinking about conducting research, who we are and how we come to know the world, how we orient ourselves from the world really does impact how we approach research. But also thinking about our positionalities, what questions are we asking? Whose perspectives is centered when we construct our research? How do we go about our research? What research paradigms do you value? If we're really interrogating our discipline, it might be painful for us to acknowledge that some of our disciplines are based upon racist practices. So what does that mean with how we come to know? Does it mean that we abandon all of it? Where do we start? Right? What research paradigms are we valuing and maybe reframing, or maybe thinking about what aspects can we continue to use and what aspects do we maybe need to think about more critically? How can we also diminish dominant identities to understand how you can conduct anti-racist research? What does it mean for you, and what are you committed to doing through and in your research? And finally, how are you going to hold yourself accountable? Maybe we need to begin by reading anti-racist research approaches in more depth. Maybe that's our first step. Maybe we need to connect with a colleague who can help keep us accountable. Maybe we really need to think about working with communities instead of telling communities what they should be doing, right? And some of us, maybe it's just simply reframing some of our previous research practices that were decent in nature, but really weren't anti-racist, right? So some of what our previous commitments that we've made, we might need to put those aside because they might be harmful or in fact, even exploitative in nature. So let's move to the next part of our action plan.
So when we think about a research agenda, one area that we often forget about includes our literature, the authors we cite. How many times in our work and our studies do we hear, well, what's in the literature? But what if the literature is grounded in racist, colonial, and otherwise damaging narratives? Now, as we mentioned earlier, an anti-racist agenda requires us to move out of our usual passivity and to take responsibility. So in the individual action plan we're going over, there's a column titled Action. And in the case of literature reviews, the question to ask yourself when attempting to take an anti-racist research approach could be, how can you deviate from the canon within your discipline and your traditional citation practices? And with this question, you can see that it's not simply about reflecting on your own practices. It also means reflecting on how the systems we've been educated in, the systems that have socialized us, and how have those affected how we conduct research? How have those systems impacted who and how we cite as experts? Now, on this next slide, we have included a literature accountability table. Could we advance to the next slide? And so here's a tool that I often use to hold myself accountable to the questions of how I am citing and who I am citing. Now, this is a literature accountability table, as I mentioned, and as you can see, it's very simple. But whenever I start to create a new article or research project, this very simple heuristic immediately spurs my thinking on how my own citation practices may be perpetuating racialized hierarchies and historically dominant forms of knowledge. Now, I'd like to invite you to think about a few questions. How does your current literature center racialized hierarchies and dominant or domineering forms of knowledge? Who do you often cite and why? What are the identities of those scholars? How many authors come from the global South or come from racialized groups? How many authors identify as female and are from racialized groups, LGBTQ+ and racialized? So usually when I fill out my own literature accountability table, in the first column, I write the disciplines, fields, or research areas within the theoretical frameworks I'm using. I list who I've typically cited or who others in the field typically cite. Now, there's a question that I often receive when I present this. How do I know I'm drawing on a diverse array of scholars based on geography, race, ethnicity, gender, etc.? This is the part that requires some work. I research these individuals. Nowadays, it's fairly easy to find someone's biography or their institutional website or social media like LinkedIn or Twitter, but it's an active step that I take to ensure my citation practices move toward anti-racism and decolonization. Additionally, and this is important, you need to read the works of these scholars. It's not simply a question of looking up their photos, because you can misidentify an individual. For example, individuals who are bi or multiracial, or those with hidden disabilities. Now, as you can see from this example on the slide, drawing from my own work that uses education and psychology texts, you'll often see the same names. And these names usually belong to white men of European descent. But this hierarchy even exists when we complicate texts that are seen as emancipatory, such as those within the critical theories. Apart from one name in the first cell of the critical theories list, Simone de Beauvoir, all are men of European descent. So by openly and continuously questioning our literature, we can move toward action. In the realm of health workforce research, this may mean questioning whether you're dependent on a particular author or institution. And it may also mean questioning how anti-racist can your research be when the literature you're using relies on racist passivity. So on the next slide, Meagan will introduce methodology.
Thanks, Giovanni. So we'll briefly discuss here how to design your research and research questions to be in line with an anti-racist agenda. Keeping in mind that, of course, we could spend hours, right, just on this one topic. So if you're listening to a recorded version of this, you may consider pausing your recording now to reflect on what it means to frame research through an explicitly anti-racist lens. If you're watching it live, you might quickly print out that PDF that I put in the chat, or just take notes on a Post-it that's close to you. What does it mean to you to take an anti-racist stance in your research design or in framing your research questions? Sharrell talked a lot about this, about an anti-deficit stance, contributing to a narrative that decenters damage, that decenters white supremacist ideologies, right? So what does that mean to you? You might, if you're watching this, a recorded version, maybe go back to that slide, right? When we talked about those baseline ideas. So think for a minute about what it means to you. Anti-racist research designs and research questions shouldn't focus on the individual, right? As Sharrell mentioned, but on the system. So we don't ask, what's wrong with people, or what's wrong with this community or this group? Why don't they do this thing? Why don't they measure up, quote unquote, to some standard set by others? It's more about what's wrong with the system. How can we change the system to better serve this person or these people or this community, to open up opportunities, to increase access, etc. So take a moment to reflect on that and consider not only what you think, but also what are your current practices? What do you do now? How do you formulate your research questions, or what do your colleagues do? What about the people or groups or labs or organizations you cite or depend on for good ideas or acceptable or valid research designs and questions, right? What does the NIH do? Once you've paused to consider those things, then take some time to consider what change you might make in your own research practices. What can you do differently? If you're taking this seriously, right, and you're thinking you want to abide by a more explicitly anti-racist approach or a less passive approach, will you look around for different types of methods? Will you commit to going further with your education in this realm? Take a class on anti-racist research methods, email us about it, or maybe you'll partner with others who seem to understand this differently than you. And then finally, think about making a commitment related to how you'll hold yourself accountable to the plans you're making today. What will you do? Name something concrete that you will do to hold yourself accountable to reorienting your research designs and research questions. Next slide.
So next up, methodology. As you think about methodology, it's important to reflect on several questions. First, reflect on your current situation and practices. How do others in my field construct methods? Does this technical rationality take precedence over how communities actually observe and measure their experience? How do I, as a researcher, construct my own methods? And then move to several questions that can push your reflection to action. How do I counter white and/or majoritarian views? How do quantitative or qualitative methods help or hinder the populations I'm working with? Is there inequity here? How are my methods contextualized to the problem? On the next slide, we'll see that there's often critique. As myself being a methodologist and program evaluator who conducts qualitative and mixed method studies, I often hear from students who will say that they have this assumption that quantitative studies cannot be critical, emancipatory, liberal, anti-racist, or decolonizing. The answer, though, is easy. Why? Statistics. But it's also necessary to understand and historicize how many statistical concepts were predicated on actively, not passively, actively racist agendas. For instance, many of the statistical tests we apply in our quantitative and mixed methods work, such as Pearson's chi-squared test, the concept of correlation, the idea of the regression toward the mean, were developed and often named after eugenicists, namely Carl Pearson and Francis Galton. And they often actively promoted scientific racism by showing false reports, for example, on how race, a social construct, affects intelligence. That said, there's also a long history of critical quantitative and critical mixed methods work, going as far back to W.E.B. Du Bois. And you can see the citation on the slide from 1899 is from Du Bois's work, where he used urban ethnography, social history, statistics, and even provided an early view on data visualization. Now, more recently, if you're interested in exploring critical quantitative work, you can also look to the work of Garcia Lopez and Velez. And much of this critical quantitative work has been coming out of the discipline of education research, but much of it is also applicable to health workforce research. To give you some ideas on how a critical quantitative mindset can be applied, think about how racist and colonial thinking pervades daily life. We can just look into the built environment using geospatial mapping, satellite imagery, engineering, building codes. We can see where sidewalks exist, where grocery stores and hospitals are built. If the city government checks whether building codes have been updated as much in neighborhoods where the majority of residents come from racialized groups. Also, what type of health facilities exist outside of hospitals? From these examples, you can see how racism and colonialism pervade all aspects of life. But it also means that anti-racist research must be interdisciplinary and transdisciplinary. When it comes to a patient's experience in a healthcare facility, a scoping review by Hamed et al. In 2022 showed that racialized minorities not only receive inadequate quality healthcare, but are also viewed as less desirable healthcare users compared to majority groups. Racialized groups also had a higher likelihood of being dismissed by healthcare providers. And not only this, healthcare workers from racialized groups are subjected to racism, such as being stereotyped and defined as difficult. Now, through this scoping study, because healthcare workers are likely to view healthcare as impartial, staff don't readily discuss racism in the workplace. But the implications around this scoping review, however, are vital for how we conduct research into how the health workforce meets the short and long-term care needs of the population. The examples are countless, but they should also prompt us toward action. As researchers and practitioners, it really requires us to see the interconnected parts within oppressive systems, and that includes how and why we conduct our research. On the next slide, Sharrell will talk more about sharing our findings and interpretation.
Thank you, Giovanni. So when we begin to think about the ways that we approach an anti-racist research approach, it really is important to think about the action plan in general, right? So we spent some time kind of going through each of the steps. So what's most important is, how are we thinking about the reflection that we're doing and actually tying it to action, and what is it that we're going to do? So beyond, now that you've recognized, for some of us, it might be, I know when I first started doing this type of work, I was really interested in the literature review, right? So thinking beyond just my research question, right? I had a methodology that I was really passionate about that I wanted to try. But for me, it was really complicated to think about the literature review and how to find articles that were actually not deficit in nature. So I actually had to rethink about my entire literature review of my research study and situate the articles where I acknowledge the deficit base, but I also critiqued it at the same time. So I think sometimes we have to be a little bit creative about what this looks like in action in terms of creating an action plan for us. So some of us might need to spend more time on the analysis or the interpretation. So for example, how are you going to hold yourself accountable to account for the implicit forms of bias in your analysis interpretation? Maybe you're not including community members and you really need to find ways to do that. But oftentimes we feel like if folks don't have that scientific experience, right, that's grounded in specific research class and it's rigorous in nature, but at the same time, we're dismissing community members' perspectives that are really valid and also helpful to thinking about the implications and the practices and the ways in which we can actually implement our research. So also thinking about sharing our findings and publications. How might we find ways to share them beyond the point of a publication, right? Where it just sits on a shelf or it just adds to a collection of research that people aren't reading, right? And so sometimes we need to really think about ways that are creative to where multiple community members can have access. So I think really when we're thinking about creating our action plan, you've had the chance hopefully to pause this, or for those of you that are here live, when you're rewinding it and watching it again, you know, how do we really think about ways that we're holding ourselves accountable to various aspects of the plan? So I really want to make sure that we have enough time to get to the question and answer portion. So I would like to go ahead and move forward to our next slide.
Great, thanks, Sharrell. A little bit more on sharing findings. How can we share findings in explicitly anti-racist ways? What does that look like, right? As Sharrell mentioned, for us as academics, we're required to publish or perish, right? If we want to get tenure or a tenure track academic position, we have to publish in these top tier scholarly journals. For many of you, you might feel a similar squeeze, right? And we'll be honest with you, sometimes making a commitment to anti-racist research requires that you do double the work. right? All of us, Sharrell, Giovanni, and myself, we've been in positions where we've done the scholarly publications, lots of them. And we've also held, at the same time, community forums, town hall meetings, workshops. We've created flyers to distribute with findings attached. We've created websites to share findings, even held art exhibits and exhibitions to display representations of representations of research created by community members. I love to refer to something a group in New York City did about a decade ago. A community research group had conducted a survey about, if you may remember, the stop and frisk policy of the NYPD. Once they'd completed their data analysis, they partnered with the Illuminator, which is a large projector mounted on the back of a big van to project their findings on the side of a large building in the city. It was a letter to the NYPD explaining their community's experiences with the NYPD policy and asking for change. So this is just a simple but really great example of how you can share findings in ways that are creative and explicitly anti-racist, that don't take a ton of time or energy or resources, but that return the research and the findings to the communities they come from and in ways that seek systems level change. So as you can consider what you can do in terms of sharing findings in anti-racist ways, be honest with yourself, right? We all have constraints. Are you in a position of relative power or not? Can you commit today to working to change the system in some maybe small way to work better for anti-racist research? I know I myself have participated in lots of meetings to make institutional changes at my own university to change tenure requirements so that community-oriented approaches to research are counted alongside randomized control trials or other similar designs. So reflect now. What does this look like for you in your context? What are your current practices? Do they need to change slightly? What are the sites of possibility? What's within your control? What might stretch you a bit, but is still possible? Is there an action you can take? Might you need to find co-conspirators? That's what I've done, right? Wherever I've been, I've always looked for people who have my same commitments and are also in positions of relatively more power than me so that we can work together to leverage the power we have in our spheres of influence. As you make these commitments and reflect on your possibilities for change, don't forget to make that accountability plan. How are you going to keep yourself accountable to the plans you make today? Next slide. So we know this was a lot of information, a lot of reflecting and writing notes for just 1 hour or less than that, really. We hope that you had a pen or pencil in your hand while you were going through this with us. We hope that maybe you'll reference this again as you digest what we've shared. As you consider ways to move forward, we ask that you try not to get too overwhelmed by what you can't do, which is so often the case, that we become paralyzed, right? The power that we don't have. But focus on locating those sites of possibility. What can you change where you are? Or maybe you need to change where you are, right? Are you in an organization that does not value anti-racism in ways you need them to? Make specific commitments. Don't just tell yourself, I need to be more anti-racist, right? What does that mean? What does that look like in specific, concrete terms? And then make that accountability plan. How will you follow up with yourself? Or will you create an accountability group in your organization or at your practice, in your department? And again, this 1 hour webinar should not be the end for you. How will you continue educating yourself to grow in your understanding of anti-racism? So thank you so much. Now I think we'll take questions. I do see one question here that I can read out. It says, for program evaluation, there is some element of needing to diagnose where disparities are occurring by disaggregating health outcomes by race, ethnicity, geography, etc. Would this still be considered a harmful practice if the focus is on improving the program itself to increase access to people who are showing worse health outcomes? I see Sharrell is answering and Giovanni also did. This is an excellent question. Giovanni mentions that disaggregating data by race, ethnicity, geography are essentially when trying to analyze and represent inequities in health settings. However, we often need to complicate how these data can be interpreted, right? For instance, as he mentions, is it possible that your audience will see the racialized group as being irresponsible or deficient for having worse health outcomes? If so, it's necessary to make an explicit note in your report so audiences don't misinterpret the findings. And that's one really important point that Giovanni and Sharrell, you're welcome to add on to here, is that it's not just about what we do, but it's about creating opportunities for those who access our research to engage in similar ways, in similar anti-racist ways. Thanks, Sharrell. Sharrell just added an article.
Yes, and I think when we're thinking about comparison, sometimes we're looking at numbers or sampling that are mismatched, right? And so if a group don't have enough participants that participate, then we're looking at groups that don't have enough statistical significance, and we're looking at communities and saying they're statistically insignificant. Like, what are the implications of even doing that? Or sometimes we're comparing groups that shouldn't be compared, or we think about all people that identify as Asian and we're lumping them all together, even though we know that the Asian population is not monolithic and very diverse in nature and have different needs and concerns and intricacies, particularly when we think about geographic location, or when we're looking at the differences, we might not be thinking about where folks have been migrating from, thinking about communities, or just thinking about the multiracial demographics of communities that are identified as Asian, right? And even our ability to organize or to categorize people is inadequate at best, right? And we want to lump people in those sums, but those can be dangerous in nature. So I just wanted to add that, is that sometimes that can be more complicated. And this article that I put in the chat might be helpful as we start to think about how do we do the work that's necessary, right? So we might need to look at those comparisons, but also complicate that and really be explicit about thinking about your research question that does maybe complicate that, or your evaluation, and make sure that you address and move beyond simply comparing, but also add a different additional, asterisks or complications around that expectation.
Thanks, Sharrell. There's another question in the Q&A. I'll read it out. Let me make sure I find it. It just says, please share more about resources for anti-racist methodologies for quantitative analysis. So again, like we've mentioned, this is just a primer, right? There's so much to cover. I put one in the Q&A of a place that may be a good place to start, and that's Zuberi and Bonilla Silva's White Logic, White Methods. But again, that's just a place to start. Giovanni and Sharrell may have other ideas that they can put into that as well. And then we can also post, I think we had talked with Michael and Xiaochu about posting a handout that we offer with a lot of different resources. And we can do that through the hosting organization. Thanks, Deborah. I see your comment in the chat. Great to know that's a good one. We like it too. There were some questions in the chat. There's one, it says, it seems like these principles more easily connect with qualitative approaches to research. How do we reconcile these approaches with the quantitative approaches we more often see in our fields? Sharrell, Giovanni, anybody want to take this?
Sure. So as I mentioned on or during the presentation when talking about methods, I think within qualitative research, we're often asked to really problematize our methods and who we are as researchers. And this is not necessarily something that's done in our quantitative methodology courses. So I don't think it's necessary to think of it as reconciling the approaches as much as it is as being intrinsically necessary to actually producing research that helps communities. I think for quantitative research, we often think of its instrumental value as opposed to its intrinsic value. But really, I think going back to the previous question as well as this one, we see a push for more critical approaches in quantitative work, especially in education. As I had mentioned, Garcia, Vazquez, Velez and Lopez have their book that's called Quant Crit, an anti-racist quantitative approach to educational inquiry. And there is an article in the Urban Review that came out a couple of years ago on anti-racist quantitative research. And so I think we always have to look back to that individual action plan. And as Sharrell noted, what does it mean when we're comparing one group to another group? How are those findings interpreted? How do we visualize our data? For instance, I've seen examples of quantitative data visualization. For instance, when we're looking at our histographs or bar charts, rather than placing race as Black or white or Asian, the researchers decided to put to compare individuals who are more likely to experience racism in the healthcare setting compared to those who were not. So meaning those who come from racialized groups versus those who do not. And they were really showing how, they were really trying to show how individuals are subjected to racism and they don't necessarily just belong to a racial category, again, because it's a social construct.
And I was just going to say that, Giovanni, I think that's the key, is that this is emerging, right? And so some of the research that I found too has been dissertations, right? So thinking about a critical quantitative approach using critical race theory to quantitative research in someone's dissertation research study, where they're looking at literature, like existing literature, and focusing on ways that like reflexivity is not used in quantitative research, but should be, and how to actually engage in reflexivity in ways that quantitative research approaches, right? How it could transfer specifically to that. And also where things are not explicitly stated, but definitely included within the research, right? So even though it's not explicit, we're not really acknowledging that we selected a measurement tool, like we selected a way to go about conducting this research, and really questioning the why and how and what got us to that place. So I think you're pointing out what needs to happen. And so hopefully some of you on the call will be interested into thinking about like critical quantitative research approaches. And I can continue to put some resources in the chat that may be helpful for you. So thank you for asking.
There's another question. It says, when you talked about broadening the literature reviews we do, I was concerned because there's literature that we just have to cite. If we don't cite it, our work won't be taken seriously. How do you grapple with that tension? I think Sharrell mentioned that in her dissertation, and I think we've all had that experience where, you know, we try to be really intentional. We may not cite someone who's problematic, even though they're cited all the time. And then somebody says, well, why didn't you cite that person or whatever? Why didn't you cite that study or that work? And that's just something that you kind of need to decide for yourself. Like, how willing are you to take that risk? I think a lot of times we assume there are rules because they're like traditions and they feel like rules, but they're actually not real rules. And a lot of times, like what Sharrell and Giovanni and I have done, and what I mentioned previously, is that you just have to find the people who will stand up for you and who will, you know, stand in your corner and say, no, that's okay. They can do that thing. Academia, practice, it's figuring out how to navigate what are actual rules versus what are traditions that maybe need to be rethought. Any additions, Sharrell and Giovanni? Nice. Oh, that feels good to feel like I answered a question well. I think there was one more. I'm like scrolling through. Okay. You mentioned that ethics and validity intersect in anti-racist research. Could you talk a little bit more about that or give an example? Giovanni, I think that's yours.
Sure. So it's interesting to think about this idea of how validity and ethics intersect, and we don't often think of them having to do with one another. But I think if we're trying to especially be culturally responsive in our work, to take an anti-racist approach, to understand how communities observe and measure their own realities, then because we're taking a relational approach, it really brings in this idea of valuing other people. And that's where you start to see this intersection on validity and ethics. One of the examples that I've been thinking about more recently is I was doing research on mental health issues this summer with 13 and 14-year-olds in my local area, and teaching them how to do research. They also taught me how 13 and 14-year-olds collect data. And, we would prompt our doctoral students to create an interview protocol or to create a survey, but those are not necessarily valid methods for 13 and 14-year-olds, nor are they often ethical. And so when you're trying to think about how validity and ethics intersect, it's really going back to what I had mentioned. Are you collecting data in ways where your respondents or your participants actually feel stronger or healthier or of worth? And so in this instance, I learned that you can get a lot more quality and reliable data through voice memos with 13 and 14-year-olds than you could with what we generally learn about in our research methodology courses. But there are a number of ideas when it comes to the intersection of validity and ethics. And I think it's really necessary to problematize the notion that there are no values around the concept of validity. But when we think about ethics, our mind goes straight to values.
There are a couple more questions in the Q&A. Thanks, Giovanni. One I answered in text, but one I don't have enough time. I can't type that fast. So I wonder, Sharrell, if you could do like a 1-minute answer to this question. Our agency has recently embarked on an effort to collect demographic data from licensees as they apply for licenses or renewals. The goal is to use that information to help identify inequities and figure out how to resolve them. However, I can see how this kind of data collection could be problematic if not done correctly. Any suggestions or ideas how we can design our data collection and analysis around demographic data to ensure we aren't inadvertently doing more harm than good?
Oh man, that in 1 minute.
Sorry, I didn't mean to throw you under the bus.
No. I guess I would just say that sometimes it might require you to push back and to say, if we release this and people take it and they extrapolate it for manipulation, that it could be more harmful. And so sometimes we might have to make those ethical decisions of, we're not going to do this type of research in this way. Another recommendation or suggestion is to think about how the information is going to be shared, and if there's parameters and expectations around that, or maybe expectations that it's not shared in certain circles because it can be done in that way. Also, like, who are we accountable? At the end of the day, who is our research accountable? What is the long-term effect? And if we can remember that, and then I think it kind of guides us to making those decisions, and we can be centered ethically about the long-term impact. Sorry, with 1 minute, that's the best.
I know. I was just going to add like 30 more seconds. And yes, to everything Sharrell said. And then also just wanted to kind of plant a seed of something that we didn't mention, which is this term or concept or practice of intersectionality. And that's just the idea that we are more than just, for me, a white woman, or more than just a middle-class academic, that we're just this amalgamation of complicated identities and various forms of oppression that we've experienced and things like that. And so when you're doing this type of data collection and analysis, consider that. Consider how, again, how Sharrell said, not presenting it as X identity is that equals this experience, right? That you make sure that your data collection both collection and analysis engage this concept, this practice of intersectionality to offer more nuance, more complexity, even to really engage messiness, especially when demographic data is often treated as very so-called objective, right? When we can just say, oh, Black people experience this, and we're going to pull out now the females experience this, right? But really kind of revel in the messiness of that intersectional work. And with that said, it is 2:00 on the Eastern time zone.
Yes, it is. With that said, thank you for the presentation. And just to let you know, if you do have resources you'd like to share on our website afterwards, feel free to pass them on. Xiaochu, Michael, do you have any final comments? Or
Thank you.
Yes, just 2 words. Thank you.
Well, I think we can all agree on that one. So thank you. It was a wonderful presentation, and thank you in the audience for attending our event. We hope to see you all again in the future. Have a good afternoon.